This is Impact Healthcare, people and strategies that are disrupting the health benefits industry. And now, here's your host, healthcare benefits industry expert and the originator of the transparent health benefits movement, Lester Morales.
Man, oh man, welcome back to another episode of Impact Healthcare. And, I think the fun part about what I get to do every day is work with people that get up in the morning and actually really care. And this is someone I have grown to be a huge fan of, Pat Staunton from Thompson Flanagan. Pat, for the folks that are listening that might not know you or Thompson Flanagan, give us an intro.
Yep. Thanks, Lester. So Pat Staunton, I am a partner in the employee benefits group here at Thompson Flanagan. I started off my career at Cigna and then ended up at a regional broker here in Chicago. And then shortly after that, came over to Thompson Flanagan. So I've been here for about 10 years. We started out, I was probably hired when we were around 20 employees and grew it to about 70 employees. So Thompson Flanagan's a boutique brokerage full service brokerage located in Chicago. We started off, so the foundation of our business is lawyers' liability, lawyers' malpractice insurance. And once that group started, shortly after that, our two founders, Doug Thompson and Larkin Flanagan, noticed an opportunity, specifically here in Chicago in the private equity space. So we started working with private equity firms, mostly in the P&C transactional insurance, so E&O, D&O, management liability type coverage. And then shortly after that, we added our P&C group and then our benefits group to be kind of a one-stop shop for private equity firms, not only here in Chicago, but now really across the country.
So Pat, I know that up until, not a couple of years ago, but I didn't really, in the beginning part of my career, I had no idea, what it means to work with a private equity company. So maybe you kind of pull that back and say like, hey, what do you do with that private equity company?
Yeah, no, great question. And really, when I started here at Thompson Flanagan, I didn't know either. I kind of got thrown into it, sink or swim. But so private equity companies, obviously, they invest in companies. And we work specifically in the small to mid-size market of private equity, which really kind of took off about 10 years ago when I started, especially here in Chicago. But what we do is we go out, we have private equity companies across the country, as stated before, and they come to us when they go to acquire a company. They do an under the hood look at all aspects of the business, and one of those being the insurance. So they come to Thompson Flanagan as their insurance advisor partner to take a look under the hood of the insurance program. So that includes the executive liability program, the P&C program, and the employee benefits program. So we get access to a data room. We take a look at all the information that they make available during the diligence process. And we put out a report that shows what the current company's spending, what the target company's spending. We point out any deficiencies, any red flags, and point out opportunities as well, opportunities for savings, most importantly. So it's really just, we are an advisor for our private equity firms. And once we go through that diligence process, we are typically made the broker post-close. So that private equity company acquires that target company, and we become their insurance advisor. There's some like the transactional side, the D&O, E&O. That's almost every transaction. We are made the broker. But on the benefits P&C, some say you're working with Thompson Flanagan. Some give us a warm introduction. But what we pride ourselves on is really knowing how to service private equity portfolio companies. Not only from an administrative perspective, because they tend to be a little bit slim and lean from an HR perspective, but also, really digging deep to find savings opportunities within the plan to create value for that private equity firm.
So, I want to jump this off on kind of how we met, right? Because, I want to dedicate this conversation to understanding how tremendously valuable taking a different look, especially as it relates to health plan design inside of private equity in their portfolio. But that's kind of how we met. Talk about that moment that you had. It's like, we could be doing something different.
Yeah. So, and Lester, I think what it comes down to is me personally, I take great pride in doing the right thing for my clients and in finding every possible solution, being a true advisor. And at times I felt like kind of, just the messenger really at the end of the day. But also our firm and our founders and the leaders of our organization are all about doing the right thing for our clients, no matter what it takes. We don't work for the carriers. We work for our clients, and we need to put the best possible solutions in front of them. So when I was, back 10 years ago, 5 years ago, even maybe, when I was delivering renewals and we're delivering 15 to 20% increases on fully insured mid-market business with very little to back it up, I had clients staring at me with a blank stare saying, "What? Why are we getting?" And I had to talk that it bothered me that I couldn't explain the renewal. I couldn't back it up. I couldn't help them find alternative solutions to kind of limit their exposure there from a cost perspective. So that drove me to really kind of dig deep. And it kind of happened a little bit before COVID where I realized it. And there was that kind of movement within our industry of, transparent, self-funded models. And it really caught my attention. And I just started to dig. I came across your name. I listened to this podcast actually, which drove me to reach out to you and say, hey, and I think it also is that, being a smaller broker competing against the larger brokerage shops, we always had to find a way to differentiate ourselves. We always kind of hung our hat on, we're the best service that you're going to get. We know we're boutique. We know how to service you. We're white glove. But we had to take it a step further. And we had to be talking about solutions that our other bigger competitors weren't talking about. So, it was kind of two-pronged for me. It was the wanting to be a better advisor for our clients, but also just finding better solutions for our clients as well.
So let's dive in. Let's go even like, hey, okay, yeah, we met up. Now it's the first group. And I remember the first group that we wrote together was not pretty. It's kind of like the wives' tale in our business that the first time you get to work with somebody, it's going to be like the ugliest of the ugly group. And they're like, what can you do with this? Right. Let's talk about kind of the before and the after from a couple of different elements.
Yeah, no, absolutely. And that was an ugly group. There's no doubt about it. And the best part about that is we really enjoyed our relationship with the CFO. And in private equity, there's a lot of change of the seats, whether it's CFO, HR. This one was there for a while. We had a really good relationship with them, and we really wanted to deliver. But they were getting a 60% increase, and I'm not going to say the name of the carrier, but it was one of the major national carriers. And they were fully insured, but they were doing some unique creative strategies with a higher deductible and reimbursement setup. But they were getting a 60% increase. And that basically from the CFO's perspective wasn't going to fly. I think the business was struggling a little bit. So it wasn't a, let's just bring difference. It was a desperate move for us. And it was not long after we got introduced to you and we had the solutions, which was outstanding. And so we were able to save them. They were facing a 60% increase with that carrier, maybe even a little bit higher. And I think the first year we saved them almost $1 million by bringing these alternative strategies to the table.
So let's we talk about alternative. Let's just use that one as an example. What does that plan look like? And I also want to talk about, as you get into that, the demographics of that specific group, because it wasn't like these were either A, high paid, or B, knowledgeable as far as benefits people, which technically are the stereotypes when companies are like, oh, that's not going to work for this type of folks. But so let's dive into the details there.
Yeah. So what we did is we moved them to an independent third-party administrator. We did put in the Cigna network. So we plugged in the Cigna network. We plugged in a transparent PBM. And most importantly, we plugged in a steerage. So we were out to find the lowest cost, highest quality providers. And that's something that wasn't occurring under their plan previously with the 60% increase. We went to that carrier and said, how could we eat into this renewal? And their only strategy was to pass on more to the employees, more onto the member. And that really wasn't what we were looking to do either. We really wanted to, and the client was willing to take, measures to impact the spend. As far as the demographic, it was a very blue collar group, a lot of Spanish speaking. So that was a very key part of not only this client, but other clients that we've rolled this strategy out to, is the communication and education. So we were out at every single employee meeting, letting them know what needed to be done, how this plan was different, what their role was within this plan, because it does take a little bit more buy-in and consumerism from the member perspective. But it was also constant. It wasn't just at open enrollment, but it was constant throughout the year. And I do think that's what it requires. Is it does take a little bit more work. But if you're working with the right advisor and you have an advisor that's been through it and has the blueprint, I think it could be a very successful rollout.
So I remember specifically these open enrollments and kind of the messaging, right? And I'm gonna paraphrase. I actually remember going to Dallas and being in a room full of hundreds of, Spanish speakers that did a very manual blue collar job, and it was very simple. Call into the advocate. In this scenario, happened to be a nurse advocate. Take their recommendation. Healthcare is free.
That's exactly right. Call the nurse. And that was on repeat, really. I mean, I remember that like it was yesterday, even though it was 3 years ago, 4 years ago. Time flies. So yeah, I mean, that's really, the communication can be broken down to a pretty simple message. And I think that's what makes these plans so effective, is that you're also giving employees choice, right? Like, call the nurse, you have a choice. You could go back to the plan design that you had before, or you can have a no out-of-pocket situation. So I think that resonates well, especially with some of those blue-collar, lower-wage employees, where they have the opportunity for an out-of-pocket. And I see it as, you have an advocate. You have someone that wants to help you navigate the very complex healthcare system. And so I see that as a plus as well for employees.
Here's the thing that, I remember you telling me this at one point, that it felt different, right? Like, it felt better. And I kind of like take that and peel that back and think, okay, in that room that I happen to be a part of that meeting, let's say the average person in that room was making $50,000. It probably was less than that, but let's just make 50 because I could do that math. And let's pretend that their out of pocket in their old plan was $5,000. All right. Let's just suppose out of 50, Uncle Sam takes 10, and now you've got a $40,000 take home. After you pay rent, car payment, food, how much is left for this person that makes 50, that in this other plan, if they actually needed to use healthcare, they don't have it? Like, talk to me about that aspect of it when you're having that advisory conversation with that employer who maybe says, this sounds like it's a little bit more work. Like, how should somebody be thinking about those two things?
Yeah, and I mean, that's really the way that these blue collar manufacturing business, which a lot of our private equity companies, that's the industry that they're in. It's how they think. They correlate it back to their paycheck and what they're receiving on a monthly, weekly, whatever it is. And whether it's their contribution that they're making from their paycheck, or it's what's coming out of pocket from their benefit plan design perspective, they are making that correlation, and they are thinking about it during that open enrollment meeting. So when you give them an opportunity to keep money in their pocket, that is a huge win. And, a lot of the times we are communicating increases in premium. I think in a way they appreciate the fact that we're taking measures to lower the claims in general and lower the spend for their employer to have a positive impact on potentially what's coming out of their pocket from a paycheck perspective in the future. And I like to hit on that during these meetings, that we are taking a more proactive approach from an aggregate perspective to lower the spend on their behalf and in their best interest.
So the interesting part of that, and what I love having this conversation, that $5,000 to that $50,000 worker is like the CEO who's making $200,000 having a $20,000, out of pocket. Like, I don't care how much you're making, like $20,000 is something that would be like, oof, like, I don't want to pay that for just accessing. That's what it feels like to an average rank and file out there.
Right. And you really don't experience it until you have a situation in which you have that much out of pocket. So you don't really think about it until something occurs where you have to have that experience of paying that much out of pocket, and you feel the pain of that money going out.
So, over the years, we've done this, now I think we're on two handfuls of folks. A direct question that I'm always, kind of interested in. Otherwise, extremely financially savvy, way smarter than my public school education, private equity company, and the execs in a portfolio. The first couple of times we have this conversation with folks, it doesn't necessarily register as much. Even when it registers on the grand scheme of things, there's a couple of handfuls of people, we're talking of a fraction of a fraction of a fraction. What would you say if you had a room full of private equity companies that are like, hey, like, I understand your business. This is like, what would you say about that? Like, why aren't they recognizing it? What should we be talking to them? What do they need to learn? All of that.
I would say there's a better way. Despite what you know or what you've heard, there is a better way to manage the spend. And for me, it's all about control. It's if you are a fully insured plan with one of the traditional national carriers, you lose control. You're handing over the keys to that carrier to control the spend. If you want to take control of the spend, like you are all other aspects of your business, this is the way to do it. And to me, it's just the simplest form of, are you getting the data you need to manage your plan? And in a lot of these plans, and especially in the mid-market private equity space that we work in, they aren't even checking that box. They're not getting the data that they need to properly manage their plan. You can't manage what you can't measure. And that's the key start, is like, let's get into a program where you at least have access to the data so that you can better manage your plan. And that's the first step. And once you kind of get that and to realize that, man, I don't have control. I don't know what's next. I could get a 40% renewal with very little backup, and I have nowhere to go. I have 3 other carriers that I can go to market to, and it's uncomfortable. And I would say that there are strategies out there. There are better ways to manage this.
Now that you've done this a couple times, what's been eye-opening to you in the data? Like, what pieces of that data are you now like, man, I'm so glad I have access to this? What are examples of that?
I would say probably the prescription drug spend the most, where we've, you and I have dug into reports from some of the carriers where it's like, okay, we can really eat into this spend. This specialty drug, you're paying this. Well, guess what? Over here, you could pay this. And there's this much of fat in that we can chop off. But it's also, for me, in just evaluating the reports that are currently available to some of these companies, is the lack of direction. They point out the data, but then it's like, all right, what do you do with that? What are we doing with that? Where are you going? This is low-hanging fruit. When you and I look at it, we're like, this is low-hanging fruit. We're going to bring the solutions. So for me, it's really been, taking that data and coming up with some really valuable go-forward recommendations to save money, where these companies are used to just reviewing the data and not coming away from it with a go-forward strategy.
What's interesting, I pointed out that a major broker's report is called the monitoring report, right? And I kind of go back against that, and I'm like, do you want to monitor your claims, or do you actually want to manage something, right? Like what is the intent of what it is that they were doing? But it goes back to, healthcare's biggest lie, that you can't manage the cost, right? So if I don't have any, mechanism in order to manage something, then really what I am doing is monitoring. So maybe you're not surprised. And I remember even in my own advisory world, going back to clients, like, we want to ensure that you don't have any surprises. And now I'm like, I think about this. Actually, that's a great transition. So the drug conversation, we just went through an episode that one drug was $700,000. Talk about that specific, scenario. I mean, we don't have to say we can say the name of the drug, but
Yeah,
let's chat about that.
Yeah, it was a $700,000 drug with the carrier that in the plan that they were in. And we were able to not only save, I want to say we saved 700, almost like 500,000.
Yeah.
Yeah, but we also think about the member experience. The member paid zero out of pocket for that drug, the same result. Maximize savings for the employer, maximize savings for the consumer and the employee. So it was an unbelievable result. And, we pointed it out up front and we delivered on the back end.
So, here was the good part about that digging in, right? It was in their, quarterly report from their carrier that showed their top, 15, 20, 25 drugs, that one drug being 700,000. Now let's peel that back. That was an infusion, right? That's a drug,
Right.
Cancer medication. That's an infusion. So that has two parts of it. The drug cost, and then how much the infusion cost. So the drug was able to be sourced using a different means for literally, I think it was $4,300 or something ridiculous, per every quarter. I think the drug cost went down to $30,000 or $40,000 annually. And then the infusion, which this is the part that blows my mind. The infusion before was happening at the hospital. Now the infusion is going to happen on the person's couch.
Yeah, which is safe. So much safer environment.
Safer. And then I've had both of my parents pass away from cancer. They don't feel good after chemo, right? That's just just the quality of that person's life. And here's the carrot on top, the cherry on top. That person would have had a $9,300 out of pocket max, and that person made $59,000 a year.
Yep, and $0 out of pocket. And that's a huge win, not only for the plan, but for the consumer.
Everybody wins. Now, let's, we pointed out, kind of the good. I want to be, real. These plans take a little bit more effort. As you think about the effort versus the value, how have you guys been thinking about it internally? And what are some lessons learned in that scenario?
Yeah, I mean, there's definitely a little bit of noise, especially up front. And any change, anything new is going to come with a little bit of change disruption. And I think it's all about how you manage that change and disruption and how you get the bottom. And I could just take one group that we recently rolled out as an example. We are collecting, anyone that is having an issue, they fill out a form, and it hasn't been an abundant amount of forms, but there have been situations where it's something that they're not used to. So maybe they go to a provider and they hand over the card and the person at the desk doesn't recognize the card. They don't call the right number. Well, that becomes an issue. How we manage that is call the advocate, right? And everything goes through the advocate. Everything goes through us. We are very experienced in working with your team and working with our team. We're very experienced in administering these plans and servicing plans. So we know how to nip that in the butt and get it taken care of quickly. So I think, especially early on, it's change, but the reward at the end is not only you have control, you have the data, and you're more than likely in every situation that we've rolled out, you're going to realize savings at the end of the year because you're better managing that spend. And I think those are three key things to take away. And you and I, we went through a meeting today with a client and we were talking about this earlier. We went through a detailed claims experience review. Last year and going on probably 10 years before that with the carrier they were with, they didn't have that meeting. They didn't have that meeting to review data, to think about go forward strategies, to identify pain points within the plan, because there still are going to be pain points. There are some employees that may choose to go the route that they used to go. But we can talk about that. We can strategize about that. We can think about better ways to restructure the plan going forward to make sure that employees are more engaged. So, and maybe it's more communication, education, but I think for me, it's really, again, it's control, and it's having that data to come up with a better, more controlled strategy going forward for our clients.
Well, and it goes back to what you said earlier, the company, the private equity company manages the heck out of every other expense. And so if your second largest expense, you're just letting it fly and not do anything, it just seems so counterintuitive, but it goes back to, if you always only thought there's nothing you could do and then there's nothing you could implement. And I think about that large claim, the $700,000 claim, absent of you guys putting in this strategy, that person would have taken that same medication, gone to the same hospital, paid the same out of their pocket, and that client would have had another $700,000 claimant.
Absolutely. And what I would say, Lester, I think what surprised me the most 6-7 years ago when I started working with private equity firms is that they are although they want to find savings within a portfolio company, obviously to create value, right? And across the business, they're sensitive to change and disruption. I will say, I think that's swinging where they are. I think the spend is spiraling out of control, and a lot more portfolio companies and private equity firms are coming to us and asking us, how do we get this under control? How can we better manage this spend? So we are getting a lot more of those calls. And I will say, the ones that have engaged on it, the private equity firms that have, they're realizing the savings, and they're seeing the results, and they're thinking about how do we do that across our portfolio? Not just this portfolio company. How do we create this value creation across our whole portfolio, which is just a huge opportunity. And a lot of these strategies can be very little disruption. I mean, when you think about RX, the low hanging fruit, there's not a lot of noise and disruption that comes with that change.
And in that scenario, when you're thinking about across an entire portfolio, right? Let's just take that $1 million of the client, and let's say that private equity company had 20 other portfolio companies. Let's not even suppose that we saved $1 million in 1 year. Let's just say that $1 million was an aggregate amount of savings for that one portfolio company over the lifetime that private equity company held that asset. What's an average conversion rate like that? The turn rate, 8x, 10x? Like what does that look like?
Yeah, I mean, when you think about the multiple there, you take 8 times, 10 times. Some of these technology, it could be 16 times. I mean, some of these, the multiple is high. So when you think about that from a multiple compare, I mean, the opportunity is huge. And again, there's some change and disruption, but there is some low hanging fruit that we can capitalize on. And that change and disruption with the right advisor, with the right strategies, with the right communication and education, it could be limited for sure.
Well, and again, I go back to, if we were talking about Swiss clocks and everything was easy and everybody loved it, then I wouldn't have an issue. But it's so funny when we talk about like, we're going to be changing something, like having to pass on another $100, $1,000, $1,500 to a deductible, taking $40 out of somebody's paycheck more, switching from carrier to A, carrier B. Like, the reality of it is most people don't like their health insurance today, and doing nothing is also change. It's deciding to change, because I have to now make a decision because my paycheck didn't go up another $1,000 for most people, and now I have another $1,000 of out of pocket. But let's go back to that, because I think about that, and then I think, wait a second, $1 million times 8, that's 8 million, times 20 companies, that's $160 million. If I'm sitting with private equity, I'm like, what other thing can you work on that creates this amount of economic value? Like, aside from firing a whole bunch of other people, I don't know what even the answer could possibly be.
And you're offering a plan that offers a no out-of-pocket solution for your employees. I mean, and so that's the other plus side of it. And those plans aren't being offered anywhere in the fully insured market. So it's a very, very large opportunity, I think, within the private equity space.
So thinking about the go forward, you now have even started to put a little bit of this on the front end. So back to that due diligence, you're even starting to look at, hey, we've got the data here. We know what these programs look like here. Here's some things that we could, tweak over there. So if listening to this, a private equity company, a portfolio company says, sure, this is a no-brainer, we want to do it, there is a way to kind of do the evaluation. You you could sample the food before you tasted it, I guess is an easy way of saying it.
Yeah, and I mean, we're very hesitant. We always have been to treat our due diligence report as a sales analysis. But to me, what our private equity firm want to know is if there's opportunity for savings and optimization. And so by pointing out that these strategies are available and the savings that come along with it, I mean, that's our job as their advisor. So we're starting to do that more. And I think the value there as well is that if a private equity firm knows that they can shave, 15% off the top, bringing them from their fully insured program into the program that's set up at the platform or transitioning them to a different alternative strategy that we have deployed here at Thompson Flanagan, that they can be more competitive from a purchase price perspective. So that's a win in itself before you even get to the post-close management of the plan. So there's a lot of advantages.
You said it. You can't control what you can't see, right? I mean, you need the data. I want to end on something too that I'm remembering. Having everybody in y'all's office and showing them, like guys that don't do benefits for a living. And I remember somebody specifically was like, "Hey, I actually have a medical procedure coming up. Can you?" Because we talk about the cost side. What we haven't really hit on, and I want to finish with, is the quality side of this. So like that recommendation isn't to the cockroach motel. It is to a high quality provider in which, when we think about how normal plans are structured, they're not steering to a high quality. Let's use the example that happened in your office just as an example of an employee who would have otherwise gone to person A, get some data. Let's talk about that piece of it.
Yeah. So, I mean, and a lot of the folks a lot of my colleagues are property casualty. It's, a big part of our shop is property casualty. So, they aren't super familiar with our world, but, he said it in a meeting with us, and I know that, I don't know the specifics for PHI reasons. I'm sure he's happy I don't, but he was going to a provider, and he, it all sitting in that meeting, it registered. He's like, man, I should chat with Lester on what the quality of this provider is. And you guys did a look at what it was, and I know it came back extremely negative. And it forced him to make a change to what provider he was going to see. And I think that also happened with one of our clients, one of the CFOs or CEOs.
It was the HR person. Yeah. HR. So the example in your office was the recommendation from his primary care physician was to a surgeon who had a 26 out of 100 score.
Yeah, right. I know he was mortified.
In that shop, right? So you go to your doctor's office and you see, behind door number 1, well, there's door number 2, number 3, number 4. In that same shop, there were people that had 80s and 90s quality scores. So this wasn't even a function of, hey, you got to go all the way down the street. This is literally like just walk to the next office.
Yeah.
And then the other client was an HR professional. He had his knee done. And I remember because the nurse was like, he's okay. But the and part of it was more that the doctor was okay. It was a mid-level. Let's just call it a B, B doctor. But really what it was is they had the surgery at the hospital where an orthopedic surgery center would have cut the price by like $42,000.
Yeah.
So, I mean, that's when you start thinking about this, like higher quality. And on one procedure, you could save $42,000. On one drug, you could save $700,000. So we're not talking about everybody having to change.
Right.
We're talking about putting in a solution that allows people the opportunity. And I'm going to go back to a word I wrote down that you said at the beginning of this, consumerism. I mean, real consumerism is actually giving somebody tools and resources to be better consumers, where our industry has just jacked up a deductible and called it an HSA and let it out the door.
Yeah, I mean, today under the traditional arrangement, employees and consumers have a credit card to go out and seek healthcare, and then when that same employer gets a renewal of 15%, they want to know why. And because you don't have control. Your employees are going out seeking whatever care they want, not doing their homework. There's no consumerism involved. There's no strategy to control the spend. Your carrier doesn't really have an interest to control the spend. So there's a lot of misaligned incentives that are driving towards that renewal. And then unfortunately the carriers don't even give you the backup to show them why they're getting that renewal. So it was a very hard, challenging message, and it forced us at Thompson Flanagan and me personally. I was driven to find alternative solutions, and I'm very happy I did. It's much more rewarding working with our clients, having these solutions that we can turn to. And some clients have chosen to stay with. I mean, we have a lot of clients that have chosen to stay the traditional route, and that's okay. These strategies aren't for everyone, but knowing that we have these strategies in our toolbox, it just makes us that much better of an advisor to our clients, and I'm proud of that, to be honest.
Awesome. Well, I'm going to leave it with what I call the mic drop moment. In the room, in the audience, in the ecosystem that we've got through this microphone, there are employers, let's call them portfolio companies, and let's call them private equity. What does Pat Staunton say now after he's got 3 or 4 years under his belt doing it this way? What do you tell somebody that they need to leave this podcast and go do?
Let's take back control. There is a way. Take control. Get the data. There's solutions are out there. Despite what your current advisor, current broker is telling you, there are solutions out there. I once didn't think there was. Long time ago, I thought that there was only 4 carriers in the marketplace. There was only one way to do things, and that was fully insured. That is not the case. There are ways, there are strategies out there to get the data that you need to properly manage your plans and take back control. And that's what I'd leave it with.
Awesome. Pat, for somebody who listen to this and says, man, I got to talk to that guy, where can somebody reach out and learn more about Thompson Flanagan and connect with you?
Yeah, so I could send my email to you, Lester, or we could circulate the email.
Yeah, I'll put it in the show notes.
Awesome. But yeah, we're located in Chicago. Anytime anyone would like to reach out to me, I'm 100% available. I'm again here in Chicago, always available.
And website for Thompson Flanagan?
www.thompsonflanagan.com.
Awesome. Well, Pat, as someone who has grown to be a big fan of yours and the industry, I've learned a lot about private equity working with you guys. I'm still shocked every day that we don't have hundreds of clients, but we're going to work on that. Yeah, exactly. I just thank you for, again, you're in a space that theoretically, and I remember when I was in an advisory role, we had a huge private equity division, and I have taken this strategy to them, and I am still waiting for the return phone call. So it really does take a special person and a special entity to, lead the charge of change. It just, is fantastic to see the success that we have, and I just commend you for leading that change. So thank you for being a great partner.
Yeah, no, thank you, Lester. It's been a great partnership.
Awesome. To our audience, if you are a private equity company, you are a company that is owned by private equity, or you just are an employer that's like, wait, I don't have to be owned by private equity to understand that just makes sense. Or maybe this is a time you as an advisor out there heard another advisor saying, it just feels good to have these plans. I would love it if you would just hit share and share this out. Give us a review. I don't ask for that a lot, but this is one of those things that this space in private equity yields so much value for a lot of people. Typically has a little bit of a bad rap, but this is one of those areas that I think, where you're doing something to enhance the lives of people and create a win-win for everybody. So if you could hit share, hit like, and give us a review, that would be fantastic. And we will see you on another episode of Impact Healthcare. Thanks so much, guys.
You've been listening to Impact Healthcare, people and strategies that are disrupting the health benefits industry with Lester Morales. Remember, the journey to getting 20% savings on your healthcare benefits starts with total transparency. Remember to subscribe to the Impact Healthcare podcast on iTunes or wherever you get your podcasts.